Good morning. Thank you for coming along. We've been joined today by the COVID Response Commander, Jeroen Weimar, and just to update the Victorian community on the current status of the coronavirus situation. Today we reported for yesterday 2,179 new cases of coronavirus. All of these were locally acquired. This brings us to 21,324 active cases. Very sadly, 6 people have lost their lives to coronavirus in the most recent reporting period. This included 3 men in their 80s from Brimbank, Darebin and Mildura, 2 women in their 80s, 1 each from Hume and Moreland, and a woman in her 50s from Moonee Valley. We take this opportunity to pass on our deepest condolences and best wishes to families, friends and community members of those who are grieving for those that they have lost. Currently we have 695 people in hospital with COVID-19. 157 are in intensive care and 101 are on a ventilator. Yesterday there were 73,942 coronavirus tests, and they were also administered through the state-run clinics, 38,752 vaccines, and indeed the figures for the state as a whole that were reported yesterday showed that across all platforms over 98,000 tests, 98,000 vaccines were delivered by all our GPs, our pharmacists and our state clinics. In regards to a few things to mark today, today is the cut-off day on which all on-site approved workers must have received their first dose. If they haven't had that dose, they need to have made a booking by midnight to get that dose within the next 7 days, that is by the 22nd of October, to comply with the public health orders. This includes a range of approved and authorised workplaces and workforces right across the public and private sectors. Many sectors, including the government, are leading by example by making sure that in the government's circumstance, over 300,000 people get the support to go and get the vaccine during supported hours, and many other private sector employers have done similar. As we work through the required first and second doses, we're calling on all employers to do everything that they possibly can to facilitate and encourage their workforce to go out and get vaccinated for the safety not just of their workplace, not just of their fellow workers, but indeed the wider community. And I take this opportunity to encourage those quite small number of Victorians who are covered by this order who have yet to take that step to go and get vaccinated. It's a question of supporting all of our freedoms, all of our rights to be able to work safely in our community and get us reopened as quickly as we possibly can and stay open safely. In regards to the Mildura lockdown, the Chief Health Officer has determined that the current 7-day arrangements need to be extended for a further 7 days, and we've had another 34 cases in Mildura today, which is higher than any other area of regional Victoria. And indeed, given the complexities of that outbreak across cross-border communities, the complexity needs another good week for that support from the community to give the local public health unit, the local health services, the confidence that they can bring this into a more manageable situation. The first and second dose rates in Mildura continue to improve quite significantly. First dose rate is now over 90%. Second dose rates are still behind the state average, but closing fast and growing quickly at some 58%. We want to do everything we can over the course of the next week to work with the community to raise that vaccination level, to protect and support those people in the community who have coronavirus or might be at risk of it, and get ahead of that outbreak and make sure that we've got the systems and the supports in place to allow that cross-border community to reopen as soon as possible. So that lockdown will be extended in the Mildura local government area from midnight tonight, so as to midnight next Friday, the 22nd of October. We're also in a position to make some announcements around some major changes to the permit systems between Victoria and New South Wales, between the red and orange zone areas. As the risk profile between the two states changes, and as we get both states moving towards a more integrated reopening position, we've got further announcements to make as to how that will work. We've had our travel permit system in place since January of this year, and today we will be announcing that fully vaccinated people in New South Wales red zones will be able to enter Victoria without facing the 14-day quarantine arrangements, including people who are not Victorian residents. These changes, made on the advice of the public health team and the Chief Health Officer, come as the Victorian community rapidly approaches, indeed is going to pass today, 88% of our population aged 16 and over having at least one dose, and 63% having 2 doses of the COVID-19 vaccine. Under these changes, which will come into operation from 11:59 p.m. on the 19th of October, you'll still require the Easy Vic Services permit, but what that will mean for fully vaccinated people entering Victoria from red zones will simply need a negative result from a test taken no more than 72 hours prior to their entry to Victoria, and then once having entered to Victoria, they must isolate whilst they get another test within a further 72 hours, and once they get that negative result, go about their business. People entering from red zones who are not fully vaccinated, including those with a medical exemption, will still need that negative test before they enter the state, but they will also still be required to quarantine for the full 14 days. And they'll also have the normal testing arrangements that would apply during quarantine periods. Further changes as part of the interstate traffic light system will also apply to people coming from orange zones. People coming from orange zones will no longer be required to get tested or to isolate until they receive a negative result. No requirements will apply to them other than the need to hold a valid permit. Orange zones conditions won't change for people who are not fully vaccinated, including those with a valid medical exemption. That meaning that you will still have to get tested and you will still have to isolate until that test result comes through. These changes have a series of consequential changes for people who are seeking to be exempted or the permitted workforce, but what they all point to is the increasing relaxation of border arrangements between Victoria and interstate jurisdictions who want to reflect those. Overwhelmingly, it's the position into the ACT and New South Wales who continue to have not dissimilar outbreak challenges. As I say, these changes will come into effect on the 19th of October, and interstate entries will still be required to get that Easy Vic Services app permit. I might get Jeroen to just take us through a few more details of the outbreak's position in the state, and then we're happy to take questions.
Thank you, Minister, and good morning. So 2,179 cases yesterday, so that really rather backs up the high number we had yesterday. So we're not dealing with a one-off high number from yesterday's numbers. We're clearly seeing another step up in the number of cases we're dealing with here in Victoria. 21,324 active cases of COVID in our community. And that means, with 55% of new cases overnight being new cases in new households, that's over 1,000 households again today, yesterday, getting the news that they've got a COVID positive case. And we know with a high attack rate of coronavirus, of Delta strain within households, we'll expect to see significantly more numbers coming out of those new households over the coming days and weeks. So these are, as ever, worrying numbers. And I'll come on to the vaccine profile in a moment. In terms of distribution, again, the same distribution really that we've seen over the last few weeks. Just over a quarter of our cases in the northern suburbs, with 585 cases in the northern suburbs. Around just under a third in the western suburbs, with 669 cases out in the west. The southeast continues to grow significantly, with 616 cases, well over a quarter, and that continues to become a growing share of our total cases. 100 cases in the eastern suburbs. And in terms of regional Victoria, again, we're seeing that continual drip feed of cases in regional Victoria. 193 cases in total in Victoria, or in new cases in regional Victoria. That's around 9% of the share of total cases, and now 1,418 active cases in regional Vic across various different parts of the state. The regional Victorian towns I'll just call out in particular, 26 new cases in Greater Shepparton, and the vast majority of those are linked, and we understand those connections very well. And my thanks to the team at Goulburn Valley Health for the phenomenal work they're doing to support their local communities, and particularly, of course, with some challenges around some of the school exposures that we've seen there. We have 28 cases in the Geelong area, or in Greater Geelong. 19 of those are firmly linked. We have ongoing investigations around the other 9. There's a number of isolated cases along the Surf Coast. All of those are well and effectively linked. And again, my thanks to the Barwon Health team for the really phenomenal work they've done to keep a lid on those Geelong exposures. We have 21 cases in the Latrobe Valley, all of those well linked and connected into the existing outbreak, and 20 cases in Baw Baw Shire across that social exposure around Druin and Warrigal, again linked to a number of understood social connections and household connections. As the Minister said, we have 34 cases in Mildura today. The vast majority of those within Mildura, a few isolated cases in Swan Hill and in Robinvale. And again, my thanks to the very strong multi-agency effort underway in Mildura to support the community again through another 7 days of lockdown. But we're really very keen to make sure that those cases are well supported, and that we uncover any final remaining cases that are still to be found, with a high number coming in yesterday, of course, impacting our view on that outbreak. Just a word around, obviously, as the Education Minister and the Deputy Premier said yesterday, around schools returning. There's a huge amount of preparation being done by schools and the Education Department around VCE. VCE starting off again next week, and my thanks to the whole school community and the many anxious parents and students as they prepare for that final stage in their educational journey. There is a lot of work now underway to support those Year 12 students and Year 11 students to undertake their VCEs safely and effectively. We have now in the Department of Health put in place a series of arrangements that ensures that any student, as we discussed yesterday, any student that may be caught up in an exposure that may become a primary close contact, there will be arrangements in place to ensure you can take your VCE safely and effectively at school. There'll be dedicated facilities set up to enable you to undertake your exam. You will be in quarantine, but you'll be able to leave quarantine to do the your VCE exams during your quarantine period. My thanks to all the schools and the teams across education for working with us to make that possible, and for all the work that will be in place. I know it'll be a very complex and anxious time for a number of schools over the coming weeks as we see COVID in and out of our school communities, but we're all very focused on making sure that VCE students in particular get a fair go and a clear run at getting their exams done at this critical time. In terms of vaccination, we continue a wide range of community pop-up sites to really boost not only the wonderful work of our GPs and pharmacists, and of course the extensive network of state clinics, to really continue to do all we can to reach those furthest corners of the state and our communities to get the vaccination job done. We have 5 additional community pop-ups starting in some of our areas where we feel we need to boost further the first and second dose vaccination rates. And they include the East Reservoir Senior Citizen Centre, which will be open on Monday and Tuesday next week. The Kingsbury Bowls Club will be open on Wednesday and Thursday next week. The Craigieburn Sports Stadium, which will be open on Tuesday and Wednesday next week. The EACH building on the Warburton Highway at Yarra Junction, and that'll be open all of next week. And the Faulkner Community Hall, again open Monday to Thursday. And in particular with regard to the last site, the Faulkner Community Hall site, that will have a disability-specific access and services supporting it. So if you need a bit of extra support to get your vaccination, we will have experienced staff, plenty of facilities, plenty of room, and a less busy and intense environment for you to be supported to do your vaccination. I can again give a big shout out to all those disability services all across the state for the phenomenal work you're doing to support those residents and those Victorians living with disabilities to get their vaccination done. If you need any further help or assistance, please do get in touch with us so we can ensure that everybody is protected with the vaccine in the days and weeks ahead. Finally from me, just in terms of vaccinations, as the Minister has said, 88% first dose for those aged over 16, 63% fully vaccinated Victorians aged 16 and above. Again, those of us over the age of 40, not only are the first dose rates continuing to rise, now at between 91 and 95% of Victorians aged over 40 are now first dose vaccinated. The second dose rates are also starting to trend exceptionally well, with for the over 40s between 73 to 82%, depending on which age cohort, being fully vaccinated. The 12 to 15-year-olds continue to do a fantastic job, and now 7 out of 10 12 to 15-year-olds are first dose vaccinated, and their second dose rates are also starting to lift. Vaccination is important, and again, looking at our local data here yesterday, 67% of yesterday's total case numbers were unvaccinated. Of the 700 or so people in hospital yesterday, 3/4 were unvaccinated. And of those 150 or so in intensive care yesterday, 87% were unvaccinated. If I turn that round, only 12% of the people who turned positive yesterday were vaccinated. Only 10% of those in hospital yesterday were vaccinated, and only 2% of those in intensive care yesterday were vaccinated. This is why vaccination is our way out of this, and this is why it's so critically important that we all protect ourselves to get vaccinated, to get fully vaccinated as swiftly and as safely as possible. Our Victorian data, based on the work that our clinical teams have done, shows that unvaccinated people here in Victoria right now are 10 times more likely to catch COVID than somebody who is fully vaccinated. Now, that's the data that we're seeing take place here. That is higher, indicates a higher trend than we've seen in some of the literature, but it highlights again that if you're not vaccinated, you are far more likely to be caught up with COVID and far more likely to end up in hospital and in intensive care. So please, we'd urge you, now is the time for us to get that vaccination done, particularly as we start to see increasing levels of movement, as kids go back to school, and as those milestones ahead of us start to open up. You will be at far greater risk if you don't get your vaccination done. I'll hand back to the Minister for questions.
Mr. Foley, New South Wales has announced hotel quarantine for vaccinated travellers is being ditched from November 1. What does that mean for people coming in from London, say, and then flying directly to Melbourne on the same day?
Well, good on New South Wales. I can't speak for what their thinking is. Victoria is signed up to the National Cabinet Plan for the reopening of international borders. We're participating in the trial of home-based quarantine as part of that arrangement, and that's what we'll do. Our hotel quarantine system continues to be in place. It continues to deliver on the caps for the international returnees. Increasingly, however, our hotel quarantine system is there to support the outbreak of people who can't quarantine safely here in Victoria. And that's overwhelmingly now the majority of cases in our hotel quarantine system. Our quarantine system will continue to evolve as our vaccination levels grow and as double-dosed returnees return to Australia, be they Australians, be they others, in accordance with the National Cabinet Plan.
Is there still a need? Under these rules, somebody could fly from London to New South Wales without having to quarantine, and then fly from New South Wales to Melbourne on the 1st of November without any quarantine.
Well, they'd have to, under the new arrangements we've just announced today, we're increasingly putting in place a flexible system that gradually and safely reopens Victoria. New South Wales responsible for New South Wales as part of the national plan.
Is that a yes?
What's the question?
Is that a yes, essentially? You could fly from London to New South
Well,
Wales.
you've still got to get a permit.
Of course, but get a negative test and a permit and come to Victoria from London essentially in just a couple of days.
I don't speak for the New South Wales government, but what I understand their position to be is that you have had to have had a negative test 72 hours before you come to Australia, that you have to be double dosed. That is essentially the same position that we are seeking people under the new, more flexible system that will come in as of next Tuesday for returnees into Victoria from New South Wales and the ACT, be they New South Wales residents or Victorians. That's a sensible risk base as vaccination levels increase. If you're not double dosed, you're subject to the more rigorous system. Whether you're from the ACT or from New South Wales or a Victorian coming back into Victoria. In regards to the international border system, we've signed up to the process that the National Cabinet has put in place. We are supporting the home-based trials for other parts of technology and how that works, and we'll continue down that path. If National Cabinet takes a different view, then we'll be part of that process as well.
Why would any Victorian fly back from overseas into Melbourne when they could just fly into Sydney and come down to Melbourne?
Well, as I say, that's a matter for the New South Wales government. We'll go through our process.
It's a matter for us because it's our border.
It's our residents putting Victorians.
So it doesn't even need to be our residents.
So we don't control the international borders. The Commonwealth government approve who comes back. The Commonwealth government approve who can leave. It will be easy to come back into New South Wales than it will be to get around New South Wales. These are matters for the New South Wales government. The Victorian government, let me finish, with greatest respect. You've asked a question, I'll try to answer it. The Victorian government is signed up to a process of easing of entry from New South Wales and indeed any other state based on risk. For the international borders, they are issues, from the Victorian government's mind, for the Commonwealth government. We have signed up to a national process through National Cabinet to be as consistent as possible around those arrangements. What New South Wales do, with great respect, is a matter for New South Wales. We wish them every success.
This way, Mr. Foley, if someone comes from London via Sydney into Melbourne, will you enforce any sort of extra quarantine on them?
They'll have to comply with the permit systems that apply in the Victorian circumstance. The New South Wales government have just announced this, as I understand it. We're yet to see the details. We don't know beyond the media release what the particular circumstances are. We'll have a good look at it. I'm sure other states will be facing exactly the same issue, but what New South Wales do is a matter for New South Wales. We'll make sure that we put the interests of Victorians in the national context of what National Cabinet's approach to international borders is, and we'll work through that as we always do.
So we'll push ahead with building the Mickleham quarantine facility?
Well, absolutely. That national facility being delivered in partnership with the Commonwealth will be needed for quite some time. As I understand it from New South Wales media release, indeed other arrangements, is that this will apply to approved double-dosed vaccine people returning to New South Wales. As we get into 2022, we will see people from around the globe wanting to return to Australia, some from very high-risk countries, and we would imagine when we see things like the agricultural workforce arrangements and others, some pretty risky situations with the status of vaccines being uncertain. In that regard, the Mickleham facility will have an ongoing role for quite some time as part of the national response.
Is this really a time we should be relaxing our borders to New South Wales? And obviously it's going to be putting Victorians at risk.
No, I don't believe so. And more importantly, the public health advice is giving the changing transmission patterns of the virus in both states and the very high vaccination status of both states. These are sensible measures to get us gradually and safely to a measured reopening and returning at least these two states and the ACT into a more COVID sustainable situation, more aligned with what we've had before the pandemic.
A lot of people will be looking at today's announcement and just wondering, is that essentially a reopening of travel between Melbourne and Sydney, a full reopening, provided you're fully vaccinated and you get these tests in the permit system? So do you need, there's no exemptions or anything for a red zone permit still, or is it? Oh, you can.
There's still, so since January we've had the traffic light system plus an exemption system, an exception system in place for really important high-skilled work groups that are hard to find and personal circumstances that it can be very, very tragic. Those become less restrictive as well. But essentially, as both states' vaccine levels rise and the protections that Jeroen's just talked about that comes with being double dosed, that plays out safely and carefully and allows us to get back to something that looks like a more normal COVID-safe existence.
How much do you think the opening will affect, say, business travel between Melbourne and Sydney? Would you describe
quite a lot.
The actual opening between them?
Whether it's business, whether it's families, whether it's allowing tourism to kick off again, these are the kind of safe measures that the public health team strongly support as our vaccination levels continue to increase and give us that protection that Jeroen referred to in his report.
How many healthcare workers aren't vaccinated?
Very, very few. So whether it's our aged care workforce, which was well into the 99% for the last report I saw, whether it's our healthcare system, well into the high 90s, we're confident that healthcare workers in particular appreciate the need to come forward and get vaccinated, as they have for some time. Vaccinations are not a new requirement in healthcare settings. It's been the case for flu and other arrangements in the past, and very, very strong support. In regards to a small number, which I'll get an update on, I'm sure, after today, I'd just encourage health services and those workers just to take that next step and make sure that you come forward and get vaccinated.
How long does the Victoria plan to keep hotel quarantine in place for fully vaccinated returning Australians who have a negative test? How long will they need to come back and sit in a hotel room for 14 days?
Well, we've already indicated that we're part of the trial process for what the Commonwealth National Cabinet process has put in place. We want to make sure that we act as part of the national process, and that's what we'll do. In regards to further announcements, that'll be a matter that I'm sure we'll work through. The direction, however, is clear. Our announcements today, our increasing confidence in a vaccinated community being able to move about safely, first and foremost needs to apply when it comes to interstate and domestic travel. We've already indicated strong support for the home-based quarantine trials, and we'll move through those trials in a safe way. In regards to hotel quarantine, increasingly the emphasis is upon supporting those people in Victoria who can't isolate safely in the current outbreak.
New South Wales has completed its home quarantine trials, which they've called a success. At what point do we become a tale of two different states?
Well, I'm not sure what the question is.
The question is how separated we currently are now
Well,
from New
we've
South
just
Wales
announced-
and how different their path is to ours.
Well, we've just announced a integration of our domestic permit and travel system to closer integrate the ACT, Victoria and New South Wales as a significant part of that. We're already part of the national trials for home-based quarantine, and when those trials are finished and when we go through a proper assessment, I'm sure we'll have more to say. So I think everyone just needs to take a chill pill. We're not aware of the full details of a media release hot off the printer from the New South Wales government. We'll go through that. We wish New South Wales, as we always do, every success, and Victoria will go about its business in the national context, understanding it's the Commonwealth who control the international borders, not the states.
Were you aware of the New South Wales announcement when you were drafting up today's announcement for Victoria?
I know I wasn't, but there would be no necessary need for me to be so. Each state is responsible for its own circumstances.
Would it change your decision now that you know that
Not at all.
travels from
Not at
overseas?
all. If anything, it reinforces the decision. This is another series of common sense steps designed to make sure that based on high levels of vaccinations and the delivery of reliable negative tests before you come, it's the same principle. So we say good luck to New South Wales, and we look forward to a closer integration of Victoria, New South Wales and the ACT based on a high vaccinated community increasingly moving around freely in a safe way that gets us back to the kind of lifestyle that we knew before the pandemic.
How long will those home quarantine trials take?
Well, that's the report will come into National Cabinet process, and I'm sure when those reports are in, which are underway right now, there's been some initial work done in South Australia, there's been work done in Victoria, there's been work done in New South Wales. We look forward to that work all coming together in a consistent way.
When, do you know when, like before Christmas?
It's already, absolutely, I would have. We know that the Prime Minister has already indicated a timetable to go to National Cabinet at its next meeting. The Prime Minister's made various announcements. Our government's made various announcements. There's nothing particularly shocking or new about this. I understand everyone's high level of excitement, and good luck to everyone involved. But this is a series of graduated, sensible steps that are being taken by governments around the country, particularly in those high vaccinated parts of the country, which are disproportionately New South Wales, the ACT and Victoria. Some of the other states that don't have to deal with the current levels of outbreak seeded from the Sydney incursions are approaching it differently, as you could understand. But we look forward to a progressive, sensible alignment as the risks are dealt with appropriately.
Minister, you mentioned tourism, and obviously we know that once we get to 70% on the current roadmap, it goes from 15 to 25 kilometres, the limit for Victorians. But this comes into effect on October 19. So theoretically, could I book a flight and go to Sydney before I could go to the Mornington Peninsula as a fully vaccinated Victorian?
I don't know where you live.
Just say Melbourne, in Melbourne.
In terms of how that works, there are still all sorts of reasons for why people need to move about across state jurisdiction areas. But in terms of how that applies, those anomalies and those parts of the systems will progressively work themselves out. We'll have more to say about what the situation looks like when we reach 70 and 80% double dose in accordance with the roadmap, when we reach those 70 and 80% milestones.
How is the state government policing companies who have authorised workers who now need to be fully vaccinated? Huge fines apply for companies who are flouting the laws. So how is that being policed?
Well, there's a series of arrangements in place depending on what sector you're in. The healthcare, both public and private, have one set of arrangements reflected in their public health orders: construction, residential aged care, freight, and now the much wider permitted workforce arrangements. Largely, the responsibility is on the employers to cite and appropriately manage the proof of the vaccine status or the vaccine process. And through our authorised officers, through our various agencies that are involved in the Department of Justice, the Department of Health and other agencies, depending on what sector, for instance, the Victorian Building Authority, WorkSafe and others for particular sectors, there will be enforcement of those arrangements with employers. We are very confident, however, from the very strong support that we've had from employer organisations and particularly leading employers, that won't be an issue, because they have warmly embraced that situation to give employers certainty and to get us open quickly and safely, and with high vaccination levels, stay open.
But it's essentially an honesty system between companies and the state government as to how much of their workforce is vaccinated.
Well, there's obligations on employers to ensure that they cite and have appropriate records to manage that. And I know from talking to many employer organisations that is precisely what's happening.
With them.
Sorry, just on that topic. There's reports teachers and police who aren't vaccinated are being sent on leave. Is that something you're aware of?
So there are processes in place, depending on the circumstances, for the very small number, and I reiterate, a very small number of people who have yet to come forward in those authorised environments to get vaccinated. If there's a suggestion that somehow or another, just waiting a week or waiting till we get to 70 or 80, that the health orders are going to change, I would urge those people to reconsider. These public health orders are there for a considerable period of time, significantly into 2022, because we've still got a long way to go in this pandemic. We have to, in the very near future, start booster shots. We have to, in the very near future, look to how, as we continue to open up, that we open up to vaccinated people safely. You are taking a very big gamble if you think that in the very short term this is going to change. The public health orders are based on very solid evidence that double-dosed vaccinated people are not going to get sick anywhere near the rate of unvaccinated people. They're not going to pass on the virus, and they're not going to make their workplaces unsafe.
So in some industries they will be forced to take annual leave?
Well, that's up to each workplace, is a bit different, but these are choices that people who, in a very small numbers, seek to put themselves outside the vaccinated economy and the vaccinated community will have to deal with.
Do you have any clarity over the percentage making that choice? So for those critical employment bases like teachers, police, nurses, firefighters, paramedics, how high is their first dose vaccination rate today?
It varies, but from the various data points I've seen, all over 90%, some as high as 99%, particularly in aged care and others, which are the areas that have been subject to those orders the longest.
So based on that, how many of those critical...
I don't have those numbers, but...
we're talking thousands of...
Well, we're certainly talking several hundred, but each of those organisations have strategies in place to deal with that, and the most sensible way to deal with it is for that very small number to come forward and get vaccinated, protect themselves, protect their fellow workers and protect the wider community.
You don't see a considerable shortage in some sectors as a result of this, to Mark's point?
I don't believe so. What we'll see is all the employers in those organisations having strategies in place to deal with this, and the best strategy is to continue to encourage and support people to come forward and get vaccinated. It's the easiest, most sensible and safest thing to do.
What happens at 80% when pretty much everyone's back to work? The authorised worker term sort of dissolves, doesn't it?
Ultimately, but that doesn't mean that the public health orders change. So you'll note that the public health orders at the moment, because they expire every month, so this will be renewed next month, and then as the arrangements change post the 80%, and we essentially get back to a much less restricted but safe working environment, the public health orders will continue to apply, because we've still got to have controls around how we make sure that booster shots are delivered, that we protect the community from when isolation for people who continue to have COVID-19 in a different but sensible way. You are taking a huge and foolish risk if you think that the expiration of these current orders will see that obligation mysteriously vanish. It will be in place for a substantial period of time, well into 2022, because we have to deliver those booster shots. We have to continue to make sure that as we open up internationally, we have in place restrictions and safeguards, a whole lot less rigorous now than they will be then, I suspect, that return us to the kind of lifestyle that we had as close as possible pre-pandemic, but it has to be done safely. And the key to that safety is being double dose vaccinated. And if you choose to place yourself outside of that system, then you have to be prepared to wear the consequences of that.
The medical vaccination directions have changed 7 times, apparently, according to an employment lawyer that we've spoken to, creating a lot of confusion in that particular sector. What do you say to that?
I say they change because the circumstances change. I think over the course of the pandemic, I think we're up to several thousand public health orders have come out. So the changes, whether it be private residential aged care, public residential aged care, different health settings, they all reflect the change in circumstances, and they are all based on the notion that risk is what's managed, and the sooner you get vaccinated, double dose vaccinated in particular, the easier it is going to be for you to be part of the wider community, and more importantly, your fellow workers and your fellow community members are also going to be protected.
Can you talk to enforcement? Sorry, can I ask about enforcement? Just for the vaccine mandate, come tomorrow, what should businesses expect in terms of authorised officers rocking up to do checks, and the fines as well? I understand they're quite large.
Yes, they are, and they vary depending on the nature of the workplace and those arrangements. They should expect the same kind of compliance regime that we've seen throughout the pandemic. There's an obligation on employers to make sure that their workplace is safe, more generally, and there'll be authorised officers, there'll be Department of Justice officials, there'll be, depending on the sector, other regulatory agencies out there able to ensure that you carry out your obligations. But the best thing, Victoria Police have a role in this wider enforcement process, but the primary focus will be on the industry and specific sectors going about their business, be it authorised officers, be it regulatory agencies, health and safety enforcement bodies, be it in building, be it WorkSafe more generally. There's a range of enforcement agencies that have been working cooperatively throughout the course of the pandemic, and they'll continue to do so. Employers, peak industry groups are all well familiar now as we hit, 21 months of this pandemic, are well familiar with how that system works.
Minister, can I just clarify, people in New South Wales can now visit their family in Melbourne before people in regional Victoria can, because that's not happening until 80%?
No, so not yet, as of next Tuesday. So if you, provided you're double dosed, provided that you've come in for a particular purpose, that arrangement, for your permit arrangement, will allow Victorians to return more freely and allow people from New South Wales to come to Victoria for particular purposes. But in terms of how we gradually work through those systems, there will of course be transitional anomalies, but as we get to 70 and 80% as per the roadmap, they will evaporate. Understanding that the roadmap essentially brings all of the state back together at that 80% double dosed figure. Noting, for instance, whilst we're talking about anomalies, the same thing could be said to apply to New South Wales, which they can return to international returnees, as I understand it from their media release, but they can't go to regional New South Wales. These things will work themselves out as the transition from our current situation through the roadmap to the graduated safe reopening that is set out in the Victorian plan to deliver the national reopening plan, will make sure that all of us, through a highly vaccinated community, can rejoin the kind of lifestyle that we also want to see again.
So transitional anomalies essentially is a yes to that question, that it's easier to visit between Sydney and Melbourne than it is for Melbourne people to travel to Shepparton.
Well, provided that you've got an approved reason, there is plenty of prospect for people to get to Shepparton or whatever else, but you've got to follow the rules. But as we deliver the 70 and 80% double dose arrangements, those rules change. So my message to the Victorian community is keep coming forward in these really strong numbers to get vaccinated, to get double dosed, and the sooner we get there, the sooner we get to the kind of community that we want to see operating in a COVID-safe way. Whether that's travel to New South Wales, whether it's travel to see our friends and family elsewhere in Victoria, the ticket to that is to be double dosed as soon as we possibly can with a vaccine that will protect you, protect your family, and make sure that we reopen safely.
Is tourism a particular purpose that would be a grounds to grant a red zone permit on October 19?
No, I don't believe so.
So what are those particular purposes then?
So on October the 19th, provided you want to come back to Victoria from New South Wales or the ACT, you just got to nominate all the normal processes, who you are, your vaccination status, and where you're going to go.
Yeah, that's what I'm saying. So there's nothing stopping Victorians going into New South Wales at the moment.
Well, I can't speak for New South Wales, but in terms of if you want to come back the other way, provided post next Tuesday you apply for that permit, then yes, you can freely move across those borders, provided that you are double dosed.
That's why you're double dosed and you get a positive test result in Sydney before you come back here.
Well, then you can't come.
What do you do?
Well, if you're in New South Wales, you are subject to New South Wales public health orders. It's not that complicated, guys. It's pretty straightforward. If you're in New South Wales, you can be subject to the New South Wales system. If you want to come to Victoria after next week, from those red zone areas, after next Tuesday, you apply for a permit. You've got to be negative test before you get here. You've got to be double dosed, and then when you get here, you get another test. And when that test releases you as a negative result, you're free to participate in the same way as any other Victorian or any other resident of Victoria is, depending where you are in Victoria. And as we hit the 70 and 80% double dose marks, those rules change. These are things that I think we would all welcome as we progressively and carefully move to a fully vaccinated, more open but safe Victoria.
So we'll still be in lockdown when this announcement takes place, so can Victorians travel to New South Wales?
Well, yes, provided that you're going through a process of approved work or situations that are in place that New South Wales approve. And if you're in a border bubble community, there are other arrangements in place. These are sensible measures that get us down the path of gradually and carefully reopening.
And you said you weren't aware of the New South Wales announcement when you drafted this press release. Surely if you knew about this, you wouldn't look at relaxing your borders to New South Wales if you knew that they were opening up to international travellers?
Why?
Because it puts Victorians at risk.
No, I reject that. I reject that completely. This is about making sure that Victorian communities can carefully and gradually reintegrate with New South Wales and the ACT, and over time, the rest of the country. I would have thought that's something that we would all welcome. The basis of it is to be double dosed and to have a negative test. These are the underlying principles of how we will go about carefully and safely reopening our communities, our economy, and get us back to that pre-COVID, or as close as we can, pre-COVID lifestyle that we all want to see. These are sensible measures. Yes, there might well be transitional anomalies on either side of the river, but they will work themselves out as we get to that 70 and 80% double dose. And it's pretty straightforward.
Do you
guys.
actually foresee the Mickleham facility ever being used? Or is
Absolutely.
it going to be a lemon?
Oh, absolutely it will be used. We've addressed this on a number of occasions. There will be, as we reopen to the world, high-risk communities from around the world that will want to come back to Australia. We will see whether it's agricultural workforces, we will see whether it's international students, we will see those countries that might not have the same efficacy for vaccines as ones approved by Australia. There will be a range of measures that in all the joint national state facilities that will see a real need for some substantial time yet for those facilities.
New South Wales will also introduce more freedoms on Monday when they hit 80%. Will we implement those same freedoms when we hit 80%?
I'll just refer you to our roadmap.
But will we bring it forward to be in line with theirs?
Well, each state goes about its own processes. Our roadmap is pretty clear. We've set out what our relaxation of public health restrictions will be when we hit 70 and 80. The sooner we hit those will be in the hands of all Victorians who are doing an outstanding job, and I look forward to both those milestones being met.
Are you under pressure to align our restrictions with New South Wales?
I don't feel under any pressure to align ourselves with New South Wales. Each state is going about its processes as it sees fit. The circumstances in each state are different, and we'll continue to operate in accordance with public health advice.
Why is the state government releasing the Royal Commission into Crown, and when or will you commit to all recommendations from that report?
Well, I think Minister Horne addressed this in her statement yesterday. I think the Royal Commission has put out a statement. Those two seem to align. When the process that Minister Horne has put in place is complete, as I understood it within the month, that report, very important report, will be released.
Is the government considering scrapping nurse-to-patient ratios?
No. The current situation that we're in the global pandemic has seen our hospital system placed under huge pressure, the pressure that we've never seen before. Our frontline healthcare workers, particularly our nursing workforce, are working like never before. We've worked through with each health service and with Safer Care Victoria to make sure that we have the appropriate acute hospital setting arrangements in place for care and for staffing levels, and that's the system that's in place. It's working well, and we've got no plans to change laws or anything else as a result of that.
Minister, we're tracking well. Oh, sorry.
The shearing industry is worried about how many shearers are moving interstate because they don't want to get vaccinated, and the impact that's going to have on Australia's wool industry. Have you heard anything about that? Are you worried about that?
I'm not particularly briefed on the shearing industry, but some of the changes that we've just announced today would make that quite an easy process, provided that the shearers were vaccinated. I'd encourage shearers, I'd encourage everyone to get vaccinated.
Minister, we're tracking well ahead of schedule to reach that 70% double dose target, so do we have any update on when we can see more freedoms granted and how today's case numbers play into that decision?
Well, as the Premier indicated yesterday, and as the public health advice has made clear every step of the way, the roadmap is set out. The sooner Victorians come forward, continue to come forward in record numbers to get vaccinated, is the sooner we get there. And we'll have more to say about that as those milestones draw closer.
Does the 25k or 15k limit have to go when we're bringing people from 900 k's away into the city from next week?
I beg pardon?
From next week, you can come from 900 kilometres away, Sydney.
You can come from the other side of the world away.
But we can't travel 15, 25 kilometres in our own city. So does that limit have to go next week?
No. Well, if you come to Melbourne, you are covered by the arrangements that apply in Melbourne. If you come to the regional parts of Victoria, you are covered by the obligations that apply in regional Victoria. If you come from London, if you come from Darwin, if you come from Sydney, if you come from Hobart, the same rules apply.
Are you worried about how these restrictions may affect our reputation on a global scale?
No.
Can we expect
lockdown city in the world.
Can we expect an announcement this weekend on taking that next step, which was expected on
What was
the
that question?
26th? Can we expect an announcement this weekend on taking the next step?
That's not up for me. It's up to the public health officials who will go through a process of making sure that as we get closer to 70 and 80% double dose, that those arrangements are shared with Victorians. We've got no announcements to make on that today. All good?
Thank you.